Hello there, and welcome to another edition of Health Matters. I am Nazim Hussain. This program is presented by the Ministry of Health. December 1 every year, for the longest while, I've always seen World AIDS Day, observed and celebrated by countries around the world. It's a time when people look back at their achievements in the fight against HIV and AIDS. The UNAIDS theme for this year is Let Community Leads. In our program today, we've got the team from the National AIDS Program Secretariat. World AIDS Day is observed and celebrated every year on the 1st of December. And this year, there's no difference. This year, 2023, World AIDS Day, the theme is Let Community Leads. And joining me on the program today, Let Community Leads, we've got managers and coordinators of the National AIDS Program Secretariat, Dr. Tariq Jagnarine. He is the program manager of the National AIDS Program. We normally call it NAPS. Next to Dr. Jagnarine, we've got coordinator for prevention and sexually transmitted infections, Dr. Keisha Chin. And next to Dr. Chin, we've got National VCT coordinator, Ms. Deborah Success. And next to Ms. Success, we've got Lisan Crandon. He is the key populations coordinator. I'll start with Dr. Jagnarine. Let Community Leads. Tell us a bit about that and how does it relate to the work you do at the National AIDS Program?
So this year's theme for World AIDS Day, Let Community Leads, it's quite an apt theme. It gives that opportunity to take services that has always been offered at the HIV program, not only in Guyana but throughout the world, but to focus on it within the communities. So ideally, you want to take the combination prevention services, testing, counseling, distribution of condoms, whether it's male or female condoms, offering of PrEP services, that's medication to prevent persons from getting HIV, and most importantly, stuff like self-testing and other STI screening to the communities. What has been happening over the years is that many communities, they practice a form of curative medicine. They wait until persons are sick and terribly sick, and then they show up to clinics to receive services, whether it's healthcare services or treatment or whatever. But now we're trying to ensure as a program we can go to each and every individual community and ensure that they can be tested, they can be equipped, they have the knowledge so that they can deal with HIV and other safe sexual practices. But most importantly, they can keep themselves safe.
Yeah, but you know, given all the work that the NAPS would have done in terms of education and sensitizing, and you're talking about millions of dollars spent on television, radio, social media, why do you think people still are adapting to that type of medicine that you alluded to?
So while the PR approach of using the TVs and television and the current campaign method that they're doing, they're effective, lots of time the message is not getting to be ingrained into person's perception, and that motivates behavioral changes. And so by working with the cultural taboos, the cultural restraints for each community, which can be quite different, what happens in region 6 can be quite different from those in region 10, you're able to adapt your approach, deal with the community, and motivate they themselves to develop strategies that works for them. For example, you can go to an Amerindian community and want to be using specific lingos and technical terms that they want to understand that are often on the current social media platforms. You want to adapt to their culture, you want to adapt to their language. And so we're trying our best to not really reinvent the wheel. The same services we're offering throughout the year, take it to the communities. And in there, by you taking it to the communities, you're empowering themselves to adapt and work by themselves. We don't have to continue being there all the time to 24/7 throughout the year. They now will realize the need, the impact that the HIV and STIs are having, and they can continue doing work by themselves.
Very quickly, you're now only program manager for about 3 years. I know sometimes you can't achieve a perfect score, but are you satisfied with the work being done despite the challenges on the ground?
So one of our greatest success is our self-testing. I really like with the launch of that self-testing, being able to reach persons, especially persons who are reluctant to coming out and getting tested, hidden and closeted individuals, being able to target key populations, being able to work with some of the communities and provide services to them. And not only that, we've been able to develop lots of new policy changes, policy updates, like our HIV workplace policy, new condom strategy. We have been making lots of successes, and with that, the program has been making great strides and leading the way towards eliminating HIV as a public health issue by 2030.
Right, Dr. Chin, Dr. Jagaran alluded to, the work done, and you have been doing work with PrEP. And of course, you're the STI prevention coordinator. Tell us a bit about your work and this new dispensation of PrEP.
Okay, so one of our strategic areas at NAPS would be combination prevention. And combination prevention basically speaks of providing all the commodities and services to prevent HIV and other forms of sexually transmitted infections. So one of the things that we would have recognized quite about 2 years ago actually is the need for PrEP, which stands for pre-exposure prophylaxis, which is a medication that a person can take. It's prophylactic. Once they're confirmed to be HIV negative, we issue this medication to the person as a prophylaxis to prevent them from contracting HIV if they believe that based on their sexual lifestyle and habit that they're at substantial risk for contracting HIV. Now, while we would have not started but try to expand that service, we would have been also identifying and addressing some of the barriers for us to have better uptake of the service within all 10 administrative regions. And one of the things that we would have recognized is the need to take that PrEP service into the community, which ties into our theme for World AIDS Day this year. So what we are going to be doing is to have training and other interactions with physicians and other cadres of healthcare workers, starting with Regions 3 and Region 4, to have full integration of PrEP and other HIV services into primary healthcare. So what does that mean for the community? Eventually, when we're finished with that integration, persons are going to be able to go to any health facility, firstly within Regions 3 or Region 4, and they're going to be able to not only access HIV testing, but HIV treatment and HIV prevention medication, which is pre-exposure prophylaxis, or even PEP, which stands for post-exposure prophylaxis. So we want to ensure that you don't have to just go to a specialized clinic. You must be able to go to any health facility within your community, and it's going to be much more convenient, and we expect that as addressing one of the barriers to uptake for PrEP services.
Someone who's curious, if you can quickly walk them through as to how this can be done.
For accessing PrEP,
yeah.
So currently we have PrEP available at quite a number of our care and treatment sites. If a person thinks that they're at substantial risk for contracting HIV, they can visit one of those sites. They can have an HIV test done for them to confirm their seronegative status, meaning that they're HIV negative. They will then be able to meet with a medex, a nurse, or a doctor or physician. And based on that assessment, the person will then be offered PrEP services. But it's quite a comprehensive package of services. So whenever you're deemed to be PrEP eligible, we don't only offer you the PrEP medication, but we also screen you for other forms of sexually transmitted infections like hepatitis C, hepatitis B. We also screen you for syphilis, and we screen you for your kidney function and your liver function. But just if I can, the reason that we are making it such a comprehensive package of services, particularly with screening you for other forms of sexually transmitted infections, is that studies or the data would have shown us that persons who frequently contract other forms of sexually transmitted infections are actually more likely to contract HIV as well. So we want to ensure that we are addressing all issues with a holistic approach to preventing HIV and to achieving elimination by 2030.
Right. So your work in prevention can be an enormous one, and can, as you try to, navigate with, managing the sexually transmitted infections. Of course, putting out their prevention messages and so forth. And recently, you've came up with a novel idea of handing out Sex for PrEP. Is
Yes.
am I getting that correct?
Correct.
Commonly known as, the man in the street, commonly called a lashback. Tell us a bit about that intervention.
Okay, so one of the things we would have done is to ensure that we provide a package. As you said, it's referred to as our Prep for Sex bag. So when we had initially launched that package, we have quite a few prevention commodities inside. So we have a brochure on PrEP, we have a brochure on HIV self-testing, we also put condoms and lubricants in our Prep for Sex bag, and most importantly, it was also outfitted with our event-driven PrEP medication. So a person, and it was also outfitted with our HIV self-testing kit. So a person would go to a facility, or even when we were conducting community outreaches, a person would be tested or offered the Prep for Sex bag. And it was also coined our famous lash bag, which is a really catchy phrase that promoted the Prep for Sex bag even more within the community.
Right. Let me bring the success now. The success, want to give away your age, but you were one who have been around a long time, even in the days of what we would commonly call the GUM Clinic, which is now the National Care and Treatment Center, and you're the National VCT Coordinator, Voluntary Counseling and Testing. Tell us a bit about your program and what's been happening for the year.
Okay. Well, the VCT program, as Dr. Chin would have mentioned, is a lot of focus now on providing a comprehensive service, and so we are doing HIV testing, which includes syphilis, hepatitis B, hepatitis C. So we are ensuring that every client that is accessing the service will have an opportunity to be able to get all these different types of testing. Now, we, in keeping with the World AIDS Day theme of letting community lead, actually, we at the National AIDS Program Secretaries, as you would have mentioned, over several years, we were actually taking the service and involving the community at all times. And now the team, the UNAIDS team of letting communities lead, we are happy for that team, and we are working because we are ensuring that communities get an opportunity to be involved in all aspects of everything. The sensitization and everything, is taking place. We have our self-testing kits that Dr. Jagna Ryan would have mentioned, and that self-testing kits is right now at a very timely point, because persons who, the element of fear will always surface among persons in terms of having the in-person test, and the self-testing kits provide an opportunity for persons to have themselves tested in their own comfort at their own time with their partners and everything. They are sensitized on the uses of the kit, and once they do the test, then they are given all the various instructions of what they need to do if it's reactive. We are also providing all the prevention tools, condoms, lubricants, and everything. Dr. Chen would have mentioned about the PrEP tablets. So they have all the information, and they can access the service without any fear. The program is focused a lot on confidentiality, and all persons involved have to ensure that the confidentiality of their clients are upheld. There is zero tolerance when it comes to healthcare providers or anybody breaching our clients' confidentiality, because confidentiality is one of the main pillars for our program.
That's interesting, the self-testing quickly. Is that available? And where in Ghana is it available?
Okay, the self-testing kits are available at the National AIDS Program Secretariat and at the various HIV STI testing sites. Persons have options. They can come to access the test. They can either have the test done right there, assisted by a HIV counsel tester, or they have an option where they can take it away and have the test done. And they're given all the instructions of what steps need to be taken if the test is reactive.
And reactive mean if it's a
If
positive
it's
test. What happens if
positive.
it's
And
not
so
positive?
if it's positive, we are not, the program do not diagnose person on one test. So once somebody having a reactive test, they are recommended to go to the closest health center so that the test, so they can have a confirmatory test. And once it's confirmed, then the necessary counseling and everything will be provided, and they will be navigated to be enrolled in the care and treatment program. I think in Guyana we have one of the best care and treatment program for the Caribbean.
I'll come back with Dr. Jackman and he will talk a bit about that. But let me talk to Isan now. Stigma and discrimination, we still see that there are cases of stigma and discrimination, even though some organizations would have done research showing that that has been significantly decreased, especially what we call members of the key population. We still have it. Tell us a bit about your program as it relates to stigma and discrimination.
Okay, thank you, Nazem. So indeed, stigma and discrimination is still an issue in Guyana, not only amongst the key population, but also in the general population. Now, my work, I'm the coordinator for the key population program. Key population speaks to men who have sex with men, transgender, and sex workers. So they comprise the key population. So what we find happening is that persons from the key population, they experience stigma, they experience discrimination on a daily basis. How do we know this? We know this because of our affiliation with CSOs who are actually on the ground working with the community. So we have taken some approaches based on those feedbacks. We have worked on the softer side of things, and when I say the softer side, meaning direct interventions through trainings. So for this year, we have conducted numerous trainings across the country, starting with our very own healthcare workers, sensitizing them about stigma and discrimination and how it affects persons, especially persons who are already vulnerable, meaning persons from the key population. In addition to health workers, we've been working with the joint services, the police, the fire service, the prisons, GDF. In addition to that, we've also extended trainings to various organizations, governmental organizations, that is, NIS, the post office, GRA. These are just to name a few. We are continuing along that line. We have been working also with CSOs, sensitizing them so that they in turn will further empower the members they support. Now, in addition to that, we've also been doing direct intervention. Because we're keeping our focus on the team, which is to let communities lead, our approach, it does not work in abstract. So all of the programs are interlinked. So what happens is that we were able to conduct several outreaches throughout the country, primarily working with CSOs, with persons who are also members of the community, allowing them the opportunity to go out into various communities at places where we call hotspots, where members of the key population frequent, whether they hang out, they interact, and we offer combination prevention. Because in offering combination prevention, that is what keeps the population safe. That is what keeps them free from HIV. And with that, our incidence and prevalence of HIV is likely to be reduced.
Thank you, son. Dr. Jackman, I'll come back to you before we talk about treatment. One of that population we didn't really talk about is young people.
Yes. Yes. So part of our program, it's not just looking at the key population, it's also looking at vulnerable populations. And as you mentioned, young persons, especially women, girls, they are vulnerable to HIV, and there's even other groups such as the migrants, prisoners, and then clients of sex workers like minors and lovers. But in particularly the program, when it comes to young people, we've for a long time designed specific initiatives that are tailored to them. For example, we've restarted our program of going to schools, Most schools, they can see persons come in talking to them, not just about wrong the topic about safe sexual practices, but talking about bullying, preparing them about leadership, preparing them about gender-based violence, stigma, discrimination. And you know, Nazim, we live in a society where there's so many terms now that are coined around the LGBT community. And then if you don't know these terms and don't know how to refer to individuals, you can be easily contributing to stigma and discrimination. So we've been working with the youths to teach them about this. We've actually have a tailored manual how to deal with those youths who are in school versus those who are out of school. And added to that, we've actually have a robust peer educator program at our national services there that train individuals to start working with youth. So we are working with youths and trying to see ways in which we can tailor programs to ensure that they keep safe. Because
and if agencies want to establish their own pre-education program, can they ask the NAPS to invite the NAPS to start up a program there?
Definitely. There are many large organizations, I wouldn't say the names, but they would have reached out to us and we would have trained ambassadors and peer educators of those organizations. This is the way forward, to have people to teach you about better and safe sexual practices.
Right. Persons live with HIV and AIDS, and that's how World AIDS Day, came about. In Ghana, we've got a reasonable sized population that who are on treatment, and that no doubt takes a good chunk of your budget. Tell us a bit about your treatment program and how is it, now as it today compared to it was many years ago.
So Nazim, in Guyana, it's estimated about almost 9,700 persons who are living with HIV. And of those, sadly, we just have about around 6,800 who are enrolled in clinics. That's a large number, 6,800. But the program has transformed over the past 2-3 years, where we're no longer using those extensive cocktail of antiretroviral treatment to treat individuals. We've gone to very good, effective treatment. Specifically, we're using a drug referred to as TLD. It's one of the best recommended WHO ARVs. It's a drug that you're seeing rapid viral load suppression. That's the number of copies of the HIV virus in an individual comes down very fast in a matter of 14 days once you stay on treatment. Your CD4 count, that's where the cells in your body that fights off the virus, that goes up very fast. You have less side effects from the medication. You have the reduced chance of developing resistance. Added to that, we've started a robust program. Like I mentioned, we only have 6,800, and so that gap that I mentioned, we need to find those individuals. Many persons would have joined the clinics, and for whatever reason they would have left. Some of them would have migrated, and so we're actually starting a program referred to as the Lost to Follow-up, or a retention and care program, where we find individuals who are positive and we ensure we can bring them back. The care and treatment program is so robust that we just don't look at giving you treatment. We look at giving you services such as social support services. If you need help with the public assistance that are being offered through the Ministry of Human Services, we even offer you food hampers. We link you towards counseling at the sites where we can sit with you. We have a hotline service. Persons can call in whatever challenges they're having. We're trying to make a system that adapts and works for you. We have a buddy system too, where we can ensure that you have someone that is checking in on you to get your treatment. We do multi-month drug dispensing now. I know there are many persons out there, they're afraid that they have to be coming to clinic every month. But we can give you treatment as much as 4 to 6 months once you ensure that you will check in with us.
And so, Doc, as we wrap up our program, in trying to reach that UN AIDS and global deadline of ending AIDS by 2030, I know you and the programs considering and have started this whole idea of integration, where there is no longer an HIV site, but it's just a walk-in to any or most of the major health service providers to be taken care of.
Definitely, Nazim. Two of the biggest things we've launched this year is to look at that first, primary healthcare integration. And it's not that Guyana is trying something new. That's evidence-based practice from many of the other countries who would have achieved elimination. Not necessarily elimination too, but HIV control. What they did is ensure that all primary healthcare facility that you show up, you can access all HIV services, whether it's prevention or whether it's testing. And so the Ministry of Health, in collaboration with many sub-department support, would have started an elimination focus. And HIV is paramount and part of that elimination focus. And we're looking at all avenues in which we can ensure that we can set ourselves and pave that way towards eliminating HIV by 2030. And so integration is the first step. And with that, we still need the communities to be part of what we're doing. And that's why I felt that the theme of this year, Let Community Lead, is quite apt.
Just 30 seconds for each of you and Victor. Dr. Chin, do you think we can reach that 2030 deadline?
Of course we can, especially since we have already put all systems and measures in place to ensure that HIV prevention and STI services are available to persons within the general population.
Ms. Success, do you think we can reach that 2030 deadline to end AIDS in Guyana?
Definitely, we will, and we are working towards that. We are ensuring that the first step needs to be taken is to know your status, and we're taking the service to people and encouraging them to have themselves tested to know exactly what they have.
Lisa?
Importantly, ensuring that the key population that they reach with combination prevention services, that is the way to go. We've already embarked on several activities to ensure that they're frequently tested, that they know their status, and most importantly, if there's a need for them to get treatment, wherever they go, they're not faced with stigma and discrimination.
Doctors and ladies and gentlemen, thanks a lot for being on our program. This has been a special program to commemorate World AIDS Day 2023 with the theme, Let Community Leads. This is Nazim Hussain. Thank you for being with us. You can be a part of the NAPS team also by logging on to our Facebook page. Join us again next time. Until that time, stay safe.